Have you ever wondered how the disinfection and sterilization process work? Well, I'm going to show you. The process of disinfection eliminates many or all pathogenic organisms except bacterial spores, while sterilization kills all. When you're disinfecting, after each use of each instrument that you use, you're going to place it in the ultrasonic cleaner, which is then going to jiggle each of the instruments on a rack in the solution for about 15 minutes. Before you put that in, you're also going to put a cup of warm water and fill it all the way up to the line of the ultrasonic cleaner and put in a tablet to dissolve in that to make the solution. And once you put the warm water in and put the instruments in the tablet, you'll then start it. Once it is finished, then the dental assistant will take it out and lay it out to dry. While it's in the ultrasonic cleaner, you can go disinfect the room, but we normally do that after the whole process is done. Then you'll get the room ready for the patient, and then you'll be good to go. Once the dental assistant finishes the disinfecting process, all the instruments will be put in the sterilization process. The instruments are done in the ultrasonic cleaner. You take the rack out and dump the instruments on a towel to dry. You'll take all the hand mirrors and dry them off with your hands so that they don't have smudges all over them. Once the instruments have dried, or you can dry them all yourself, you then place them into each pack. Each pack will have a pink dot on them, and once they come out of the autoclave, the pink dot will then be brown, identifying that the autoclave has reached a specific temperature to kill all life. You put a piece of tape on it that has multiple lines, so when it comes out, the tape lines will then be black and identify that the ultrasonic cleaner and the autoclave have reached a certain temperature. You'll put a date and initial it so that everyone knows that you put that in there and you did it the right way. Once you have them in the pack, you'll lay them face down in the autoclave to stack them correctly so that way they will be sterilized. Once they're in the autoclave, they'll reach a specific temperature. The tape will change and the dot on the package will then be brown when it was pink when it went in. Only fill the autoclave up to the line in the basket. If you don't pay attention to the line and you fill it up too high, the autoclave may not be able to sterilize every instrument the way that it's supposed to. Every once a month you'll put in a spore test, which will test the autoclave to make sure it's working properly and that it reaches a certain temperature also is another test, and you'll send that off to make sure the autoclave is working correctly, or else you'll not be able to use it and you'll have to fix it or buy a new one. Putting the instruments away, all the drawers in the lab will be labeled. All restorative instruments will go together, all surgical instruments will go together, and all the basics will go together. The basics include an explorer, cotton pliers, and a mouth mirror, which will be for everything. The restorative will have the hand pieces, which the hand pieces don't go in the autoclave. They don't go in the ultrasonic cleaner. Instead, when you put all the instruments in the ultrasonic cleaner, you'll put lubricant in one hole and a cleaner in the other, which the cleaner and lubricant bottles will show you how to do that. Once you do that, you'll package them and then put them in the autoclave and then put them away. They don't go in the ultrasonic cleaner. So once you put all the instruments away, then the assistant will disinfect the treatment room. The treatment room has barriers over the headrests, the armrests, the light handles, the drawer handles. Those are to protect or to have less availability for cross-contamination. So you'll take the barriers off, wipe them down with Cavicide wipes, which are also in solution that will disinfect the handles and the armrests and everything else. Once they're done, you will put new barriers on so you can get ready for the next patient. And you can flush the lines at the end of the day. You take a bucket and fill it up to the line with solution. You'll cut on the high volume evacuator and the saliva ejector, and you'll let it suck up all of the solution. Once it's sucked up, then you'll fill up the bucket to the line with water. Let the lines flush that out so you clean all that bacteria and stuff from other patients. You'll clean that out. Once each process is completed, all instruments and treatment rooms are ready for the next patient. And this process needs to happen to assure infection control and make sure each person that comes in doesn't cross-contaminate the next person with what they might have. So having this process is a big deal, and taking your infection control certification and passing it is also a big deal, because every place is going to need that. So just make sure always that you're doing the right solution in your ultrasonic cleaner and your autoclave is always working correctly, or else your instruments won't be sterilized and it can contaminate the next patient. Thank you for watching.